We have a problem in America with our health care and our health insurance. We covered that last week about how there's a lot to be said about health insurance and who pays for it and how and why, but not a lot is actually talked about health care and improving people's actual health. We talked that lifestyle is a massive driver of this problem, and until we address those issues, there's always going to be an issue. And so one of the ways that would be a good way to address those is by incentivizing people to have good health, not just good health insurance. And at the end of last week, I briefly mentioned my idea for a new form of healthcare, a better form of health insurance, I think. And I want to talk more about that today. So we're going to cover it again. Just go back over what it is and what are some of the drawbacks to it, how you might implement it, and what some of the opposition would be for it. So at the end of this one, then I'll remind you again, but I would love for you to go to the website and to follow the link in the description to retirementmentorship.com/72. This is the 72nd episode, so /72. And that'll take you to the blog for this post. And at the bottom of the post, there will be a form where you can add a comment, ask a question, any of those things. And I would love just to get some feedback for you guys. I think it's a good idea. It might be a horrible idea, but I'd love some feedback from you. And if you have super political friends that are always talking about politics and are always complaining about health insurance and health care and you know, on both sides of the aisle, I would love for you to send this to them, have them listen to both, and get some feedback. So without further ado, let's jump back into it. My idea for fixing the health crisis in the United States is to incentivize health, not health insurance. And we can do that through what I'm calling the American Incentivized Medical Act, or the AIM Act, as it's time to focus on the true problem and aim at better health, not more insurance. So some of the core aspects of my idea, my plan, is that of course, there's full coverage for non-lifestyle diseases and accidents and pre-existing conditions that are non-lifestyle related. Full coverage covers all that. Nobody's got any problems with health insurance covering, you fall out of a tree and break a leg, or you're in a car accident, or you get some rare disease that you had nothing to do with and didn't deserve to get. That's what a health insurance is for, right? Is you slowly pay in a little bit of it over time. You're almost like escrowing your own money for a future health event. And sometimes you'll have that event and it will cost less than what you've escrowed. And sometimes you'll have that event and it'll cost more than what you've escrowed. But either way, then you're either helping to contribute to other people's health events or they're helping to contribute to yours. And it all works out in the end. But it's underwritten, the plan is underwritten for lifestyle issues. And so the premium would be based on your age and your health. The younger you are, the cheaper it is, and the older you are, the more expensive it is. Also, you tend to make more money the older you are as you get more experience, more skills, and so you should be able to pay those higher premiums just based on your age. But also, you're, of course, usually less healthy the older you get, and so it makes sense that you pay the premiums that are closer to the actual costs that you will incur. And then, of course, also based on health, not including lifestyle things, but any lifestyle issues. And so that health, that rating that you would get would be determined by multiple factors, including weight, blood pressure, cholesterol, all those normal things that they test for in health and life insurance. The model is based after the way that they underwrite life insurance. And similar to life insurance then, based on those health factors, you would get a health rating, which, you get a standard rating, which just says, hey, you're of average health. You could get a preferred rating that says, hey, you are of above average health, which means that you're less likely to need any medical care for lifestyle diseases. So we're going to charge you less for your premiums. Or you get a table rating, which is, hey, you have all these indicators that say that your health care, not your health insurance, right, but your health care is going to be more expensive. You are living in such a way that is going to cost money. And so you must escrow more of your own money to help pay for your future health care. We put the responsibility for our own lifestyle choices and the health consequences thereof back into our own hands. And so if you want to live in a very healthy way, then you can live in a healthy way and pay less for your healthcare because of it. And if you want to live if you don't care as much about that, then that's fine, but you need to pay for your own healthcare then. And part of it, I think that would be is you'd have this option to lock in your rating. Like they do that with life insurance, right? You can get a 5-year, a 10-year, 15, 20-year level term insurance policy, for example, where we're going to lock in your current age and your current health for a certain amount of time, and your premiums won't change based on that. But then after that time comes up, then you need to reevaluate or re-underwrite and see if you're still healthy. And if you are, we'll give you a new policy. And if you're not, we're going to charge you more than we charged you originally. And so I think in the same way, you can either get, directly underwritten for health insurance, or when you have your annual checkup with your physician in your hospital, they can, determine that rating and submit that, and you would lock that in for a couple of years if you want. You probably won't be able to lock it in for 20 years like you can with life insurance, but at least a few years. That way you're not having to do a physical each year. That way it'd make it easy for people. If you're healthy all the time, you're going to remain healthy, then it'd be nice to be able to lock that in for a few years and not go through the hassle of having to do that. Although it's also good to just have annual checkups and make sure that everything's still in tip-top shape. So we have that. And then, of course, you have the ability to improve your rating. And so if you are, you get a standard, but you're like, man, I could really be healthier if I tried. And, you could work out more, eat a little better, lose some weight, build a little muscle, clean out your arteries a little bit, and you get a better rating. And then you pay even less for your premiums. Or you're very unhealthy and you've always wanted to lose weight, but you just never really had the motivation. Seeing the dollars improve might give you more motivation to improve your health. And then you could get a better health rating and therefore lower premiums for your health insurance. And this, to me, has a number of benefits, right? The main one being that it incentivizes health. It doesn't incentivize just owning health insurance. It actually incentivizes people to be healthy. And this is the core aspect of the plan. If you are spending a lot of time and money and effort being healthy and making healthy choices, then it makes sense to compensate people for that by paying less for their health insurance. They're not going to need it as much, so they should be able to pay less for it than if you're making a lot of bad choices. And if you want to be healthier, then this gives you an incentive to do that. Like imagine this, right? You're at your annual checkup, and this is the story for millions of Americans. They're at their annual checkup, and their doctor's like, "Yep, this is high, and this is bad, and these look bad, and you're this much overweight, and all these things. Like you should really work on that because it's not going to go well for you. See you next year, right?" And there's just like, okay, yeah, I knew that. I knew I wasn't healthy. Like I didn't really need you to tell me that, but it's a little worse than I expected. But there's just nothing behind it other than like a promise to feel better, which you don't really know what that feels like until you've experienced it. A promise to look a little bit like there's some of these intangible things that take a long time to come about, and I think are just not motivating enough for a lot of people to make a lot of the real changes that they would need to make to be healthier. But imagine that if you went to your doctor and said, "Hey, this is your health rating. You're a table B, right? 2 levels below standard," which means that based on your age, here's your health insurance premium. It's, I don't know what it is, right? $400 a month. If you get back to standard, which to do that, you would need to lose this amount of weight and bring your blood pressure down to these numbers by our next checkup or the next time you underwrite. If you were to do that, your health insurance premiums would go to $300 or $200 or whatever. Right? So like some analytical nerds would need to figure out exactly where all this breaks down. That's what actuaries are for and all that. I don't know what the numbers would be. But imagine if they said you would have $200 more in your pocket every month if you lost X amount of weight or became X amount healthier. Right? Real numbers. That'd be cool. Are you saying I can get $2,000 more a year to do whatever I want with if I just lost 10 pounds or what, whatever the metrics were? That would be incentivizing. And suddenly it wouldn't look so bad to spend X amount on a gym membership or X amount for some, workout at home thing or some, whatever it takes to do that, right? Accountability group or whatever else. Like you could afford it because you know that if you do it and you get the results, you will automatically make all that money back and then some and premium savings. And so you would lower your premiums by being healthier, and you would save hundreds, if not thousands of dollars a year and tens of thousands over your lifetime. And the thought of doing that, even just from a financial planning perspective, is pretty great. But from a motivating standpoint, I think it really incentivizes people to be healthy and not just have health insurance. Another benefit, I think, is that it promotes ownership, right? It puts us back in control of our own health and our own finances, right? We're no longer dependent on the government or on big insurance companies that to tell us how to behave or how healthy to be or what things cost. Like, we can have a direct impact on our own level of health and what we pay to maintain that. And there's just a lot to be said. There's a whole, I'm not an expert in this, but there's a whole science, right, around personal responsibility and personal ownership and how much meaning that brings to people's lives when they have that sense of ownership, that sense of responsibility, and are not being victims, but are taking that ownership. It's very empowering. And that promotes that ownership with people. It also restores freedom to people. I think one of the problems with the Affordable Care Act when it came out was the health insurance mandate, right? That you must have health insurance, and that you're trying to control people and what to do. And for a lot of people, that alone was a reason not to do it. Like, I don't care if it's going to be better. I don't care if you say that it's going to be cheaper. If everyone just gets on it, it'll be cheaper for everyone. It'll be better for everyone. The fact that you're making me do it, it's not great. That's a non-starter for a lot of Americans in the land of the free, right? So, but if you have this freedom to do whatever you want, right? If you don't want to be healthy, you don't have to be. If you want to eat fast food every day and stop at a gas station all the time and drink, 5 cans of soda a day and get your big gulps and whatever else, bags of chips, you can do that. You can do that. No one's telling you how to live. There isn't, we're not banning anything. We're not saying, hey, you can't have MSG and things anymore. You can't have trans fats. You can't have sugar. You can't, we're not mandating anything. You have full freedom to live however you want, healthy or unhealthy. But you will have to pay the full weight of your choices instead of relying on other people to subsidize you. So you have the freedom to still live however you want, even if it's unhealthy, and other people have the freedom to not pay for your choices. So it restores freedom on both sides. I think it increases child health quite a bit. And I don't know where this would break down exactly. So perhaps children 12 and under aren't underwritten, right? Because there's just not going to be a lot of difference for those. But children 13 and older maybe could be. Maybe there's just a standard group rate if you don't want to get them underwritten, but they could get preferred rates if they were healthy, right? And so that would incentivize parents to keep their kids healthier, right? If you're going to pay more because your kids are unhealthy, maybe it makes more sense to get them better food and make them eat better to be healthier so that you can save money. And kids, they have a limited control over how healthy they are. Really, a lot of that responsibility for young kids is with the parents. But if there's a direct incentive and a direct cost, to letting your kids be unhealthy and a direct savings to helping them make healthy choices, then maybe a lot of people, say, hey, it's time to replace the Mountain Dew with LaCroix. It's time to get rid of you're eating junk food every day and make it more a rare thing and find some healthier snacks. And so I think that would just be a huge increase in child health. Again, not forcing anyone to do anything. You can let your kids drink pop every day if you want. So there's still that freedom, but I think it would incentivize and increase child health, which is good for kids, and they don't have a lot of control over that. And of course, there'd be a massive, massive reduction in our national health bill. Because we're not just moving money around and figuring out who's paying for healthcare. We're actually getting healthier. We actually become a healthier nation. And so the overall health bill goes down. So as a nation, it would go down. As individuals, it would go down. People who choose to be healthier and to help control things in the environment they can control to be able to make healthier choices, their bill would obviously go down quite a bit. And think about what we could do with all that money. Think of all of the other health things we could actually invest in, more mental health, better infrastructure, better entertainment, even more money for the family. The amount of things that we could do when we're no longer paying for sick care, but rather investing in just good health, it really quite inspiring, quite fun to think about how much we could do if we weren't spending so much money on health insurance and paying for unhealthy choices. So there's tons of benefits, I think, to incentivizing good health instead of incentivizing health insurance. I think there's some optional aspects to the plan that I haven't decided whether I like them or not. And this is where some good feedback, I think, could be interesting and have more of a conversation. One, a junk food tax. Now, my personal bias is I'm not a fan of taxes. Once they start, like, they generally keep getting worse, right? They don't, hey, we're gonna make a toll on this road to help pay for a new bridge that we're putting in. Bridge goes in, the toll booths are still there, right? It's hard to get rid of taxes once they're started. And so adding another one, just in principle, sounds like a bad idea to me. And this is why this is not part of the core aspects of the plan. But hear me out. There are people, there are companies, industries that have been addicting us to junk food, right? That they have entire food science divisions that their sole focus in billions of dollars of research, I don't think I'm exaggerating when I say billions, goes into how do we make this very unhealthy food cheaper and taste better, regardless of the health consequences. Right? As long as it's not actual poison, doesn't matter how unhealthy it is. If we can make it cheaper, make it tastier, and make more profit on it, then let's do that. And that's their entire goal. And so we're not eating healthy whole foods anymore. We're eating scientifically manufactured things to addict us. And they're addicting us at a level that's similar to nicotine and cocaine. Some of the sugars and sweeteners and additives and things that they put in there is actually creating food addicts. And I think they should pay. I think there's a case to be made anyways that if they have been making billions and billions of dollars off of addicting people to their products, that they should have to help pay for the consequences of those profits. Right? Now, this does not absolve anyone of their personal responsibility for their health choices. Right? So I'm not in any way saying, hey, we're going to tax junk food and that's going to pay for the whole plan. Like, everyone, I think, still has their own, here's your premium based on your health rating. That's the core part of the plan. What I'm saying is I think there's a case to be made that those who have profited off of us becoming unhealthy should help pay for the consequences of that. Right? That's ownership. That's companies and the people running those companies taking responsibility for their actions in the same way that we all as individuals will take responsibility for our actions and the premiums that we pay. And ownership is a big value of mine, and so I think there's an ownership piece that should be there. Now, we're not trying to get free insurance. We still pay for it, but we want to make them pay their fair share. And I think what you do with that is you tax ingredients that we know to be harmful, right? Sugars, sweeteners, unhealthy fats, chemicals that are addictive, all those things. We tax those ingredients. So we're not at the store. It's not like, hey, you ring up all this food and here's another 10% junk food tax that's stuck on top of it. They're taxed at the ingredient level to the manufacturers before they package it into a ho-ho or a bag of chips. Now, they're just going to pass that cost along, right? Like, companies don't, like, there's this false idea out there that if we just taxed corporations more, they should make them pay their fair share and then great, we'll all be better. But, like, they're not going to absorb that. They're just going to pass that cost along. I know that. We all know that. But that's fine. And here's the deal, right? Just behaviorally, I think, if a 12-pack of Coca-Cola costs $5 and LaCroix, right, sparkling flavored water, no sweetener, costs $5 also, people won't switch. They've been drinking Coke their whole lives. It tastes better. It's got, all those things that make us crave it. And LaCroix tastes like licking the inside of a Laffy Taffy wrapper until you get used to it. So they're not going to switch. But if you're taxing sugar and aspartame and sucralose and all the things that they put in there to make it addictive, And now because Coke needs to pass all those costs on to you, it costs $8 for a 12-pack because that junk food tax is baked in. Now, if you can get LaCroix, a 12-pack of LaCroix for $5 or a 12-pack of Coke for $8, you might switch. Right? If a bag of apples costs $4 and a bag of chips costs $9, you might buy the apples for your kids instead of the chips. And you're like, that would be outrageous, like $9 for a bag of chips, like $8 for Coke. I don't know, it's probably that much already in some places, but that's the point, right? If you were paying for it in the choices you made at the time, instead of paying $1,400 a month for your health insurance, which again, I don't think people really realize how much their health insurance is, especially if their employer picks up a huge part of it. But for many families, they're paying anywhere from $1,000 to $3,000 a month between what they're paying and what their employer is paying for their health insurance. If that went away, right, and you started making $2,000 more per month because you were healthy and made good choices, you could afford to buy a $9 bag of chips every once in a while. Again, freedom. You can do whatever you want. But it will immediately, at the time of purchase, make you realize this is the true cost of this food. Because the true cost of a 12-pack of Coke is not $5. It's $5 plus all the health issues that those choices compounded over time will bring you. Right? Time magnifies the margin between success and failure. It magnifies the margin between health and unhealth. And all those choices added up over time end up costing, nothing, bam, $10,000 ambulance ride after a heart attack, plus thousands of dollars in hospital bills. Right? But instead, if that cost is baked right into the food, and then that cost that's passed along then for that care that will eventually be needed if you eat too much of those things, then it helps. I think it just helps us see more. It helps us take more ownership and see more of the effects of the choices that we make. And that then becomes incentivizing to eat healthier. And I think we need to end this excuse that like healthy food is more expensive than junk food. I don't know if you've heard that. I certainly have. Sometimes it's true. Oftentimes it's not as true as people think. But if there's this huge tax on junk food that was then supplementing the health care that will eventually result in, and there was no tax on healthy foods, a lot of companies would just start switching over to making more healthy foods. And then with more of it out there, there's more supply, which means and more demand, but more supply for sure, which should bring down prices and make healthy cheaper and better. And people will then eat more healthy things if it is cheaper and they know all the other good benefits of it. You always have the freedom to buy junk food. I love burgers. I love ice cream. I love beer. I love all kinds of stuff that's not good for you. And I will still buy that all the time. But a tiny portion of your future heart attack is now baked or deep fried into that price. So I think there's an argument to be made anyways for a junk food tax, although I'm not set on that being part of the overall plan. I think one of the other things that would come up would be employer issues. You can't probably have employers be paying a percentage of people's things. Right now, right, it's the same cost for everybody, right? Insurance companies charge employers a flat amount per person, and they're baking in all the unhealthy and healthy people into that flat premium. It's a group rate. But if you had incentive-based health insurance, then everyone's rates would be different. And I don't think it's a good privacy thing, to reveal that to employers. So first of all, like if employers would only pay a flat amount of employee health insurance, right? Hey, we pay, they would have to, I think, only pay a flat amount. Because if you paid a percentage, it would cause discrimination. Because then they're looking at someone like, hey, if we have to pay 50% of your health insurance premiums, this person is going to be cheap. And this person is going to be very expensive. So let's hire this person, right? And that's going to cause a lot of discrimination against people who make unhealthy choices when they would be totally suited to the job, right? They've got all the necessary qualifications for the job, but they would cost the company more for health insurance. That might start causing some discrimination. So I don't think you can do a percentage. You have to do the same rate for everyone if employers were still the ones offering health insurance. It could be then essentially free because maybe it's like, hey, we'll pay $200 a month for every employee's health insurance, and X more for their family. And so for really healthy people, their insurance could be covered completely by their employers. But, there might be some privacy issues there with employers. But I think it might even be better to have it not be through work anymore. That rather than employers having to spend thousands and thousands of dollars to provide health insurance at group rates, since everyone is now underwritten for their own choices, you could just stop offering it through group and you just do it in a marketplace. And that would free up massive amounts of money that employers can now offer to their employees just in salary, regular compensation instead of in healthcare. If your total compensation stays the same, but less is going to health insurance, that means more towards your salaries. And that makes it easier, I think, for small businesses to compete when they no longer have to fool around with insurance. Because that's a huge attractor for small businesses, is that they don't have the scale to offer these big and pay for a lot of these big, health insurance plans that big mega companies do. And if it just goes away from employers and becomes an open issue, that's a good advantage for them. I think if you were to implement something like this, you'd have to do a phased rollout, right? We couldn't tomorrow saying, hey, everybody's going to pay based on their health rating, because many premiums would fall, but other premiums would absolutely skyrocket, right? The price of years of bad lifestyle will now show overnight, and we can't expect people to be able to pay that overnight. And so I think when you would pick a date, like a year out or so, maybe more, and you could get a free online rating estimator right now, and you could actually get an actual rating. It wouldn't go into effect, but you could get your actual rating at a primary care physician or by a paramedical examiner like you would with life insurance, and say, hey, based on this is your rating. Now, it doesn't affect your premiums until next year, but when the incentivized healthcare rolls out, this will be your premium. And if you can't pay that, then you've got 1 year or 18 months or whatever it is to turn that around. And that's a pretty good incentive to get after some things. So I think you would have to do some kind of phased rollout for implementation. Then lastly, this is already getting longer than I expected, but you have some major opposition to something like this happening, right? I think there's tons of benefits. A lot of people would benefit from it. I think it's a great idea, but you'd have some huge opposition, which would probably make sure that nothing like this could ever happen. And there's big industries with deep lobbying pockets that would be against this. And so I think here's a few categories of people of things that the four bigs that I'm going to call it that would be against incentivized healthcare. Number one would be big food. Big food companies with all their science divisions that make and profit massive amounts of money from unhealthy food would obviously be opposed to, especially at any kind of tax, but even with it, opposed to anything that could damage their profits. And they would put a lot of lobbying dollars into opposing something like this, which I think is dumb, right? If you're a big food company, just switch over and use that infrastructure to build healthier things. Pepsi already owns Bubbly, their version of sparkling water. Coke already owns the AHA brand of sparkling water. And you just make less Pepsi and more Bubbly. You just make less Coke and more AHA. And it's cheaper. It's got to be cheaper. It's just water, naturally essenced or whatever they call it, right? But there's not all the other ingredients that are in Coke or Pepsi. And so it should be cheaper for you to produce some of these healthier foods. And you just gravitate. So I get that they would be opposed to it, but maybe they could be a better person, a better company by adopting healthier foods instead of interrupting them. That'd be number one, big food. Number two, and I was just trying to make these all big, so I don't mean this to be offensive, but big people, right? In that this is going to cost people who want to stay unhealthy lots of money. They're not going to like that, right? Been getting subsidized for decades, and from all the people who are healthy, and now they're going to have to take ownership and responsibility and pay for their own choices, and they're going to be opposed to that. Not all people, right? There's a lot of people who are, not as healthy as they'd like to be, and they want to be healthier. And this, I think, would give them some incentives, some real money back in their pockets to be able to do that and to make the changes that they've always wanted to make. That's the whole point, right? Incentivize people to be healthier, not punish people for being unhealthy. And especially if you had an implementation phase and all that, we could make this a good thing for everyone. But there definitely would still be some people that would oppose this just because they don't want to change and they want to keep having other people pay for them. So number 2, big food, big people. Number 3 would be big healthcare. Hospitals make a lot of money on treating lifestyle diseases, and they will lose out a lot of business when people don't need them as much. Right? When people are just coming in, when more and more people are coming in for a healthy checkup, that then they're on their way, and not for lots of money and profit-inducing operations and procedures and treatments, they'll lose a lot of business and they'll lose a lot of money. And I always joke that like some of these hospitals are the most profitable nonprofits I've ever heard of, and they make lots of money by treating sickness. And a lot of that will go away. And so I could see them being opposed to it, even though they're supposed to be for people's health. Let's be real. Behind the scenes, where the actual checks are being written, not the doctors, not the staff, right? Not people who are actually helping people. They would all be for it. But the administration of hospitals, the people that make the money and that track the books and that make those decisions and control the purse strings of their lobbying organizations, they would be the ones that are opposed to it. And then lastly, and similarly, big pharma, right? That makes billions, trillions of dollars a year managing lifestyle diseases. Not curing them, managing them. That's where the money is. They don't make money by curing diseases. They make money by managing them. And they would fight this hard. This is where you'd get the most opposition to something like this, would be all these companies that would lose out on trillions of dollars of profit if people stop needing their high blood pressure medicine, stop needing their cholesterol medicine, stop needing this, that, and the other thing, and the 3 other drugs to manage the symptoms from the first 2 drugs. That's a lot of money that's going out for these things, that a lot of it would just go away if people got healthier. So they would fight this tooth and nail. And how would they fight? They wouldn't fight it directly, right? Not mainly. They might, hire some people, hire some talking heads, bribe someone, whatever else to try to slam the actual plan. But more likely, they would fight the candidates who would support something like this. If you had someone trying to implement this, they would do ad hominems, attack them personally, attack them for other things, try to get them unelected so that they could not implement something like this rather than fight the idea itself. Because the idea is a good one. And so they'd find other ways to fight it. So it'd have a lot of opposition. And that's why I think it'll probably never go into effect. But I love the incentives of it. I love the benefits of it. I think a lot of people would love to be healthier and would love to save tons of money doing it. So it's an interesting thought. So the American Incentivized Medical Act, incentivizing health instead of insurance. What are your thoughts? Go to retirementship.com/72. That's the episode number for this. And scroll down to the bottom of the outline there and share your thoughts. You don't need to add any contact information if you don't want to. If you just want to leave a comment, you can. If you have a question and you want us to get back to us, want me to get back to you, you'll need to leave an email address so that I can get back to you. I'm not going to add you to any lists by doing this. This is just, I want a discussion just around this one topic. And then share this with your friends, hit the share button in your podcast player. You can share the link to that website, that webpage with them, and they can find links to their podcast players there. I would love, especially people that either are in healthcare, right? I would love their perspectives. If you're in healthcare, especially if you're frontline, or even if you're admin, anybody in healthcare, I would love your thoughts on this. Would you be for something like this, or would you be against it? Anyone in insurance, anyone who's politically minded, and anyone who's none of those things, and just regular people like the rest of us. It'd be cool to start a discussion around this. And do you think that incentivized healthcare would be worth pursuing? What are the problems? What are the benefits? Let's start a discussion. So retirementship.com/72. There'll be a link in the podcast description as well. And hope to, if we get enough comments or enough people, doing stuff about it, we'll do a follow-up little bonus episode just with some of those comments, some of those things that you guys found. So looking forward to that. Thanks for listening, and we'll see you next week.
If you enjoyed that, you would love being part of our free membership community. It's called Retire Membership, and it has a host of benefits, all for free. For example, you can always buy my book, 3D Retirement Income, on Amazon. But if you join us at Retire Membership, we will send you either a hard copy or paperback for free, provide the ebook and the audiobook so that you can listen to it if you don't have time to read it. In addition to that, we'll also provide you with a bunch of content that you can't get anywhere else. For example, we have our quarterly Retire Mentorship magazine, which comes out quarterly and has no ads whatsoever. It's just timely content to help you stay the course. We also have workbooks for our free online workshop to help you get the most out of those, flowcharts to help you make better decisions, and a weekly email to provide timely content that you can unsubscribe from at any time. We never ask for any payment information, and we never share your information with anyone else. We just want to provide timely content and help you stay the course to retire successfully and stay successfully retired. There's no reason to wait, so join us now at retiremembership.com, where you can click in the link in the description and it'll go right there. We can't wait to see you in the community. Cheers. This podcast is educational only and is not investment, tax, or legal advice.